So my name is Lucian Itu. I'm from Siemens SRL. So we're basically the Romanian branch of Siemens. And in the project we are supposed, and we are actually already working on developing the digital twin of the brain. And we're actually focusing mostly on the hemodynamic part of the cerebral circulation. Yeah, so the research group I'm part of, and which I'm actually heading, we're developing AI and computational modeling based solutions for personalized medicine applications. And so within our group, cardiovascular diseases is really a specific focus. And yes, stroke is actually, I think, the second leading cause of death and the third leading cause of disability. So now, of course, being given the opportunity with Target to further research this topic, of course, we agreed. And of course, there are also great technical and clinical partners. So yeah, that brings a lot of potential and synergy to really, let's say, make a step forward for this topic. Looking at it from a, let's say, higher level, I think the most exciting part is really seeing something that you develop being used in clinical practice. So really being used by a clinician, being used to help the patients to take a better decision. Now, of course, this doesn't happen, I think, every day, right? So I think on a daily basis, what motivates us and all of us is to, when you see actually the results improving, you're working on a solution and you see results getting better and better and better. And basically that gives you the, let's say, then the motivation to go further every day. Okay, so within Target, the digital twin of the brain is actually focusing mostly on the hemodynamic aspect. So basically simulating and computing the blood flow in the cerebral arteries. So now if you think of a digital twin, I think there are here two main goals that we're addressing. One is to essentially simulate the circulation of a certain patient, essentially compute some quantities that you cannot measure directly. So for example, different flow rates, different pressures, wall shear stresses, so different quantities inside the circulation that you cannot directly measure with the equipment, with clinical equipment. So this gains or allows you to gain a deeper understanding of, let's say, how the circulation of the brain works. This is one part. So the second part is that once you have developed this digital twin, you can use it to try different or to compute different hypothetical states. So for example, you can try different treatment options. In case of stroke, you have different anticoagulation treatments. So the anticoagulation treatment will change the viscosity of the blood. So you change the viscosity, this changes the hemodynamics, all the quantities that I mentioned before. So this could help, and we hope that this will help clinicians then basically by trying different options to take, let's say, the best decision, which then will hopefully improve the long-term outcome of the patient, of the stroke patient. First of all, I would hope that to see more AI and computational modeling based solutions being adopted in clinical practice, because I think they have a huge potential one side for the patients to get better decisions for them, long-term, short-term, but they also have the potential to help clinicians a lot. So we know clinicians are under a lot of pressure, time pressure, have to treat a lot of patients, population is aging, so the burden, the amount of work is only increasing in time. So this is a great opportunity to help them to get more time and to take, in the end, have more time for them and for the patients. So this is one thing, and I think the other thing that I would really hope to see is to have kind of like a shift more towards prevention. So basically seeing these solutions being applied to have more prevention. So not only to treat the patient when something has happened or when the disease is already in an advanced stage, but to tackle the disease or to maybe not even allow the disease to develop from an earlier stage.